Welcome to the show, everyone. I'm JJ Flazanes, your producer and empowerment strategist. Thank you for downloading today's episode. Today, we're going to talk about understanding leaky gut. It's been something we've talked about before, definitely at my live events with Jeannie Peters, and sprinkled into some of the things that we've done over the years, but I wanted to hit it a little harder. And the reason is because at this time of the year, in the beginning of the year, January, we're in January 2022 right now, people get on diets and they want to change their diet. They want to change their lifestyle, or at least they think they're going to. And I'm here to just want to encourage you to not look at that a temporary change is going to make a big impact, especially when possibly the lifestyle you've led up until this point and the things you've been exposed to have created some damage that you're not going to undo by a temporary diet change. And I think that's really the message here, is about the underlying symptoms and problems that a lot of people have and they ignore, and they don't realize its impact possibly until it's too late. So leaky gut's a big deal, and we're going to do a lot on gut health. I've got Dr. William Davis coming back, who we did on Doctored and Wheat Belly, and we're going to talk about his new book, Super Gut. So it's going to be a lot of conversations about digestion in the gut because of its impact on our health. Before we get to today's show and I tell you a little bit more about Dr. Chris, I have two announcements. First, within this conversation today, Dr. Chris mentions a lot of different tests and resources and things that you can do. And while I know a lot of you are driving or exercising, or you're just not in a place to take notes, I asked him if he would put together a document that would give you the links to the recommended tests. Now, most of the tests that are on this document, you do need to work with a physician to do. However, I know a lot of you want to know more about it and don't want to blindly go in and just trust somebody to order a bunch of tests that you don't know if they're necessary. So I asked Dr. Chris to put this together, so he did. And not only that, he also offered the Keto Food Pyramid, which is a wonderful document which tells you what to eat and what not to eat. And we'll talk more about that within the show. But rather than taking a lot of notes, if you hear some of the tests or some of the websites, know that you can come to jjflazanes.com/leaky gut and get these documents. And not only will you get the document of all of the different recommendations from Dr. Chris, plus the Keto Food Pyramid guide, you're also going to get access to a 30-minute presentation he did exclusively at my event at the Manifestation Bootcamp 2021. I had Dr. Chris speak, and he did a presentation for my group, and it was an informal presentation, but he answered a lot of questions, and he talked about a lot of things. So if you want to have access to that 30-minute recording, again, jjflazanes.com/leaky gut. Also, within what we're talking about right now, and Dr. Chris is one of the metabolic approach to cancer doctors under Dr. Nasha. And so we definitely have sort of that agreement about the emotional piece. And so what's coming up that I wanted to announce again for you, if you didn't hear it last week, I'm doing a free workshop on Wednesday, February 23rd, 5 p.m. Pacific, 8 p.m. Eastern. It'll be about 90 minutes, called The 3 Reasons Why Traditional Talk Therapy is Ineffective. And again, if you've had therapy and you've benefited from it, great, amazing. But there are a lot of people that haven't and stay stuck for a really long time. So this is for those people. If you're perfectly happy with your therapist, don't even bother. And what you've received and your life has changed and you've moved forward and you're telling new stories and you're a different person, amazing. But if you're not, if you struggle, if you hate the idea of that, please come to the free workshop, jjflazanes.com/therapy. And both links will be in the show notes. Dr. Chris Duhon attended Vassar University and received a Master's of Science in Acupuncture and Oriental Medicine and a doctorate in Naturopathic Medicine. He has since studied in Switzerland at Periclus Clinic under the guidance of Dr. Thomas Rau. Before coming into his own practice, he was an associate and mentee of Dr. Paul Anderson, a well-known physician in the Northwest, who works with oncology and chronic disease. Since coming into his own practice, he's been privileged to work under the guidance of Dr. Nasha Winters, who has enriched his sense of terrain-centric medicine. What he discovered to be his passion all along was working with a person's terrain, the foundation of their health, their soil, so to speak. He honors his patients' uniqueness because that is how he approaches their treatments with individual, personalized care. I hope you enjoyed today's show. Welcome to the show, everyone. If you are finding us on YouTube, know that there is a podcast. You can click below and take us with you. It's an audio podcast that you can have while you're driving or exercising or multitasking. And if you're finding us on the podcast, Dr. Chris and I are doing this on video. So you can come over to jjflazanes.tv and check out our conversation. Meet Dr. Chris if you haven't already. Those of you that came to the boot camp have met him. And those of you that got the virtual ticket have met Dr. Chris. So welcome, Dr. Chris.
Well, thank you. Thanks for having me.
Yeah. I met you in Greece. Yes. And through Dr. Nasha, and we had a nice time there and of course, I'm always talking business. So we connected in that way. And a lot of people have heard that. In fact, everybody on the show has already heard you because you were already on the show with the value of a pilgrimage that we did in Greece. And he was the one who was eating, by the way, everybody, when you heard the clanking, Chris was eating. He was there eating and playing his music and tanning himself with his Adonis body. But now we're going to get serious and we're going to talk about something that I haven't actually addressed 100% on the show. And you and I have talked a lot about it. And I thought you'd be a great person to speak on this, which is leaky gut. Okay. So let's start though with a little bit more. They've heard your bio, those who are listening on the podcast. Let's go backwards though. And let's talk a little bit about how you got here quickly. If you want to give us the snapshot of Dr. Chris's life getting here.
My life. So I'm from Louisiana. I lived there all my life. Before I was a doctor, I was a priest. So a lot of people will read that in my bio. And while I was training to be a priest, I'm a spiritual director. That's kind of what I was trained for. And while I was doing that training, I started to get exposed to more alternative or natural ways of kind of mixing in with spiritual direction, like healing touch or Reiki or, some form of muscle testing or herbs. And I thought it was just so attractive that some of these practitioners who are nuns or other priests using these kind of modalities in their own kind of spiritual direction way to kind of help someone to become more whole. And that was just really attractive to me. So I started to try to develop my own, like, where did I fit into all this? And that was one of the questions that I was asking at that time. And I started working, I met a nun who basically trained me in herbs because she was an herbalist and she was living near my parish at that time. And so that's kind of how I had my start. But the program, I graduated from Creighton University in Christian spirituality and spiritual direction. And the program was very introspective. So it forced us to look in, and there was a lot of uncomfortability with how my life was progressing as like associate pastor, and things just didn't fit. And so I started questioning. And that question kind of led me to the realization that in order to do what I feel like I was being called to do, which was to kind of really have more of a holistic approach, that I needed to step out of the priesthood and probably go back to school and get more of the physical element, because I had a lot of the spirituality and that sort of foundation. What I didn't have was I didn't have an understanding of the body and how I knew it kind of all worked like together, right? I knew you couldn't divorce the spirit from the body or the emotions or everything. I think everything works as a congruent whole. But I needed the physical piece. And so in 2006, I moved up here to Seattle, and I started working on another master's, this time in acupuncture and Oriental medicine. And then during that time, I decided to just expand my scope and go for the naturopathic doctor. And so I became a naturopath. I graduated in 2015. I decided to stay here. The original intent was to go back and to be in the South, because people need help down there. And there's not a lot of nutritional guidance in that area. I call it like that's a dry area. I'm here in Seattle. It's like I'm in a bubble, right? Because we live in, it's just all around us, good food, fresh food. Down there, it's not as much. It's getting a little better over the years, but Still needs to kind of progress quite a bit. So, but I decided to stay up here, and practice up here. And I did a residency at Holistic Healing Arts, and their main focus was infectious disease and autism and all kind of really chronic, really people that were just so sensitive, to any little thing. They've been to so many doctors and nothing was working for them. So they would go to this clinic. So I ran more of the IV portion of the clinic, and I did about a year there. And then I was hired on to be the lead physician with Dr. Paul Anderson at his new clinic. And I stayed there for a little over 3 years as their main doc, and I was seeing patients. It was at Dr. Anderson's that I met Dr. Nation Winters. Right, literally the same year the clinic opened is when I met Dr. Winters, and her and I became really, good friends, colleagues, and she was still seeing patients at that time. So probably about 2017, her and I started sharing patients. And she would send patients my way that were kind of in the area or close to the area or that needed the type of therapies we did in the clinic. And literally these patients would come with like a document that was 56 pages long. And that was Dr. Winter's treatment plan for them. And so then what I would do, so what I would do is I would literally read that treatment plan from cover to cover or page 1 to very end. And I would help them, kind of integrate it bit by bit because it was so enormous. And that's what, Dr. Windsor would tell me. She was like, get the main pieces, and she would kind of guide me and, and then I would guide the patient. Right. So that's kind of how we started. And we shared quite a few patients, and we still do, to this day. Well, she doesn't see patients, but, we've consulted over a lot of patients that, are still in my practice. So that kind of brings me, I think it was maybe after my 3 years at Advanced Medical Therapies, I decided to go on my own. And for the last 2 years, I've just been doing my own practice. Really a simple practice. It's just me and an admin assistant. I'm noticed since COVID that I'm more virtual. I used to not be like that. There was people actually, when I first started on my own, people were coming in to see me. And then I had a little bit of virtual. But what I've noticed now is that basically the majority of my practice is virtual. And I have patients all over the US. I'm not just here in Seattle, but I have them, on the East Coast in New York. I have some in Maine. I have some in Florida, Texas, in the mid part of the country, California. So I'm kind of broad. I even have international. So I've kind of broadened out in the last 2 years to help people. My primary focus is oncology. So I don't really do, I mean, I will have just every once in a while, like a family that'll come into my practice and I'm helping one of the parents, and the parent wants to, I want you to see my husband and my wife and my kids. And so then it'll become a family ordeal. And then the focus for that is not so much oncology, it's more prevention. And it's more helping them through, like when I see young, like 18, 19-year-old individuals, the main thing that I like to do with them is more their epigenetics, because their bodies are so resilient at that time, that if we can kind of straighten out some of their epigenetics, that, it can help them avoid just a lot of pitfalls in their life. And whatever else in their terrain needs to be corrected at that time. So that's kind of how I got my start.
And I just want to point out that, so when Dr. Winters started her metabolic approach to cancer mastermind / certification, you were part of the first group of people that went through that. So you've been doing this for a while with her and through the writing of the book and creating of the course and being one of the people who are kind of referred to a lot through her program. And back when I was putting together the boot camp and Nisha was coming back from her pilgrimage, and I said, any chance you would want to come speak at my event? And it didn't work out because she had concert tickets for her birthday. So we didn't have that. And I thought, I was on a walk and I thought, oh my gosh, because she doesn't even see patients anyway. So while it would have been great to have her come, I'm like, okay, that doesn't help me get people help. And then I thought, oh, well, I want you to come and speak to the group because you
Yeah.
still work with people. And so this is one of the reasons why Dr. Chris is here. And of course, he can do many, many things. And I know you are specializing in oncology, but what you have is also what people want when it comes to prevention and when it comes to some of the terrain items that someone doesn't have to have cancer. In fact, if you do it preventatively, then you won't get cancer.
That's right.
If you look at some of these things. And so it's come up a couple times as we talk about diet and leaky gut. And again, I've mentioned on the show, Jeannie's mentioned on the show, but we've never done a whole show around digestion and this idea of leaky gut. What is it? How do you determine what it is? I'm just seeing so many people that are so sensitive to every food all the time. They're
Yeah.
always they're always inflamed. They're always reacting. And I know some of these people who've been on medications, antibiotics, have had stress. I know what their past habits and patterns have been that possibly have worn down the vitality and the integrity of their digestive tract. So let's just start out by saying and explaining to people what leaky gut is technically.
Okay. So just technically it's, you have these, they call them gap junctions, right? It's just a space between each cell in your intestines. And what happens is when people have leaky gut it's the intestines become inflamed to the point where those gap junctions sort of open up, and it allows molecules that don't normally get out to get out of the gut and into the bloodstream. And it's in the bloodstream that our immune system will see that, and then it'll generate antibodies, or that's why you see the sensitivities when people eat certain foods, is because their immune system has kind of gotten a hold of that information and has now, created like antibodies for it. So anytime that food is even eaten, these antibodies will start to increase in the body, and then they'll have reactions. And the reactions can be something as simple as like a leaky nose, upset stomach, abdominal pain. It could be, all of a sudden you just get this bout of diarrhea or constipation. They can actually go the other way. And they can be, headaches, skin problems. Skin problems are the biggest thing, I think. I think a lot of people don't really link their skin to their gut, but you have to understand that the inside of the gut is skin. It's an epithelial, it's a tissue, right? And it's how our bodies communicate with the outside world. So, it's the one space that, we take things in through our mouth, and it's the foods we eat, what we drink, we're putting into our bodies, and that has a communication with the body. So when we have leaky gut, like I said, those gap junctions are opening up and things are getting through that shouldn't get through. And it's a little more common than what people think, because right now you have glyphosate is rampant, right? And
Let's talk about what glyphosate is. Let's educate people on what glyphosate is.
Yeah, so glyphosate is essentially it's basically Roundup, that has been kind of genetically modified,
a pesticide
to be put into like a corn or a sunflower, or you name the seed. It's already kind of in there. And so when the seed grows, it basically will repel. It's supposed to repel insects, right? So, and same thing when they spray the crops with Roundup, that's what they're spraying with. Now, the thing about glyphosate is that it's meant to destroy a bug. And where it destroys the bug, it destroys the bug's digestive system. And so here we are taking foods that are coated or contaminated with that, and it's literally destroying our own bugs in our gut. And so that also, at that point, that also leaves us open, open to more leaky gut, open to a weak flora. Our immune systems kind of wax and wane at that point. So there's a lot of things that kind of happen, when we do that. So really it is about the foods we eat, the choices we make, because your gut flora can change after one meal. If it's an awful meal, it can take a big hit. If you're eating 2 or 3 awful meals, you're really doing some damage.
All right, let's talk about some of those foods. And then we'll talk about how we can test for it and what
Okay.
people can do. Because I know I've
Sure.
heard you guys talk about in terms of cancer patients, and my guess is, correct me if I'm wrong, you've talked about how when you work with a cancer patient, that it can take up to a year to fix their
That's correct.
digestion. But is that because they've gone through chemo and radiation and
No,
had, or is that just normal daily
that's
diet?
normal.
Normal
That's
daily
normal.
diet. Okay.
Normal
So I
day.
want I
Yeah.
want people to understand that because this isn't a short-term project. This isn't
Yeah.
take some probiotics and you're done. This
Exactly.
is this is a repopulation. This is a healing of the tissue and some of
Exactly.
the things that you can do to heal the tissue and then of course not agitate it again. So let's start talking about the foods that cause leaky gut. And actually the other things that we know that cause. So glyphosate,
Yeah.
which is on
So
your foods. So
yeah.
what is that?
So, things like corn is one of the biggest things, right? So corn is one of the more heavily sprayed crops. Same thing with wheat, same thing with some of the grains that, we may run across. There'll be, certain grains, they've been sprayed, conventionally grown vegetables and foods are probably one of the biggest assaults to our gut because they're sprayed, they're irradiated, so that's really where we start, right? With what we putting in our mouth and the choices. So we have to be more detectives in what we choose. We have to the first thing is it's always a preference for, organically grown, but even in some organically grown, you have to be a detective. You have to ask, you have to ask, where was this grown? What did you spray anything? It's almost better, in this day and age, like to grow your own vegetables. I know that's it's not a thing for some people. It's not a possibility for some people, but the ones that it is a possibility for, then they know exactly what they're putting and what they're putting in. Like we grow our own kale, some of the summer vegetables that we eat here in the house. We grow that. We don't spray in our yard, but a couple of years ago, I got a glyphosate test. Now I eat a really, really good diet. I eat pretty much organic, total organic. Anything that comes in this house is organic. It's not, I shop local. I don't ship in anything like that. I try to get everything from some of our farmers in the local farms. And I still had traces of glyphosate, in my body. So that tells me that there's a little bit of cross contamination, that's going on in some of the food that we're eating. So it's you want to really think about the foods you're eating, and like I said, organic is going to be better than conventional, because conventional, the soil is bankrupt. It doesn't have the minerals, the vitamins that a good healthy soil would have. And also, they spray herbicides, pesticides, so that really does affect us, you know.
So let's talk about, okay, so corn, wheat, and grains. So basically we take those out. That would be the first step. But I want to go
Yeah,
back to the testing,
sure.
because I know that things like your CRP, right, your C-reactive
Sure.
protein, is an indicator for inflammation.
Yeah.
And so we're looking, but I also know that there's like a whole test of, I've never actually had a glyphosate test and I'd love to have one. I know there's a whole like talk screen of all kinds of environmental things that
Yeah.
I've never had.
Yeah.
And of course, the geek in me wants to take every single test possible just to know where I'm standing as a preventative measure. But what would be a test to start with? Because I'm guessing if someone has higher levels of glyphosate, the likelihood that they have leaky gut is probably more. Yes?
So at this point, I can pretty much assume that most everybody's going to have some trace amount of it in their bodies. Just like, I'll give you a good example, like another one is called, we call them the forever chemicals, right? It's chemicals like flame retardants, that they started using like post World War II. And I think it was like a little docu-series. It was by John Oliver. It was from a comedic standpoint, but it was very funny. It got the point across. But they called them forever chemicals, right? And they are forever because it's hard to pull them and extract them out of the body because the body has no mechanism to get rid of it. The body's never seen things like this. The body can get rid of some things because it has pathways for that. But there's no known pathways. So the best thing to do is to actually sweat, right? So when people have forever chemicals, a lot of times it's because They brought new furniture, they had that new car, they have a carpet, and all that off gases, or a mattress. And they just breathe it in, right? It's sprayed with flame retardant so that the house doesn't catch on, or if it does catch on fire, then, it's not going to just burn crazily, right? So that's part of what they were, the idea of it. But what in the studies, what they're finding is that literally everyone today, everyone they test across populations in the world has traces of forever chemicals. And the only blood that they found that did not have it was pre-World War II, that they had froze the blood from these veterans. That's the only blood today that does not have those types of chemicals. So that's kind of what we're sort of working with. So it's those kind of things even affect the gut, right?
Well, but there's probably levels. So, okay, so if you have
Yeah.
traces, and I probably have more than traces
Yeah.
than you, because I'm not as diligent as you are, even though I'm pretty good. But so let's say I have a certain amount. I'm guessing that obviously the higher the levels, the more likelihood someone has leaky gut.
Yeah. Because, usually what we're seeing is where, you kind of look at the body as kind of a whole, and you're looking at the body so when I see people and, I'm looking them in a terrain fashion, I'm looking at patterns, so when people have like overexpressive, like glyphosates or acrylamides or things like that, then I'm seeing, just a pattern of toxicity. And that's kind of what I'm pulling the string to deal with, that pattern, right? So when they're coming up, like if I'm looking on their tests and I'm seeing like low levels of protein, like high levels of monocytes, high levels of eosinophils, high levels of basophils, I'm starting to my spidey senses are going off and saying, we probably need to check the gut at some point, because, there's chronic infections or, these co-infections that are underneath everything. They're just running underneath the radar. They're drawing resources from the body, but people aren't showing up with symptoms, right? But it's because the body's trying to quarantine that area and keep it from getting out of hand. So it just draws resources, valuable resources that you could be used in other areas, right? So when I'm seeing those things on a test and I'm like, okay, well, let's take a closer peek at the gut. And to do that, you want to do like a stool test. That's usually the first thing. So whether it's a GI map, GI effects, doctors have their favorites, right? But we want a stool test. We want something that's going to show not only the flora and the condition of the commensal flora, but also if there's any pathogenic opportunistic bacteria that's kind of ruling the day. We also want to see the digestive capabilities of the gut, like calprotectin, some of the inflammatory markers. We also want to look at secretory IgA, because that will tell me, a lot of times if there is an ongoing infection that the gut is struggling with. And then the other one that we can really tell is it's a test called zonulin. And zonulin will a lot of times let us know if there are, if those gap junctions are open wide. So without going into just a real in-depth explanation of zonulin, it's just when I see zonulin on a test, I'm like, okay, I know that this person has some form of leaky gut. All right. And to heal that, it's not, there's steps that we do, right? So this is step number one. We have to kind of assess the terrain, and we have to see what's going on. We have to see how imbalanced is, the flora. And a lot of times people may carry H. pylori and they don't even know it. And that kind of creates downstream effects, because what H. pylori does is H. pylori will increase the pH in the stomach. In other words, make it a little higher than what it normally is and less acidic. And so what happens as an effect of that is protein doesn't really get digested completely, and it goes into the gut, and then it's still in the gut, is not fully digested. So then it starts to putrefy and what we call rot. So a lot of my teachers at Paracelsus, so part of my training was at Paracelsus Clinic in Switzerland. And they have a really great way of working with the gut. They have remedies and things that we don't have here, and that I have not found a supplement to equal. to be honest with you. I mean, I can throw herbs and all that, but the things they use at Paracelsus actually work with what I call the humus of the gut, which is the soil. And that's really what we have to focus on. It's not about giving more probiotics. It's not about doing all that, because that's just like throwing seeds on, soil. And if the soil is rocky and it's not really tilled, it's not going to grow. Those seeds are not going to take. But you want to have really good humus. So that's really what the GI map is assessing. We're assessing the humus of the gut, right? And if you have H. pylori, I know that you're going to have more opportunistic infections, because you have what we call food rotting flora. And it means that it's just, these are bacteria that, are taking up space that are creating all kind of havoc, in the body. So that is the first step. So, we want to assess the soil.
Okay, so I know that people are like, oh my God, what is this test? Where can I get it? And just so that you all know, we have a document that we've put together of all of the different recommendations Dr. Chris has, as well as his information, and that you can get at jjflazanes.com/leaky gut. So don't worry, you're going to have all this information that you don't have to write it down. We're going to provide links for where to get tests, as well as a link to work with Dr. Chris to get these tests and assess your situation. But just know that you'll have a resource guide at the end of this show today. So you don't have to worry about taking all these notes and wondering where hey, ask him about the link. Where do I go? You're going to get it. jjflazanes.com/leaky gut. All right. So we're going to test first, of course. And there's going to be a stool test. Say that again.
Zonulin.
Zonulin. Is that a test? Or is
it's an add-on. You can add it on to GI Map. You can add it on to the GI Effects. You can just add it on. It's just more information, more data.
Okay.
Right.
And is there anywhere that you would? So is it mostly just? Is there any blood? Is it just stool, or is there any blood tests?
No blood.
Okay.
I mean, there is blood. Like if I'm just going to do a CBC-CMP, then I can actually assess the gut through that, and that would be like the doorway, and that would be what will lead me to like a more in-depth examination of like the gut. And the stool test is just number one. We also have to assess the allergies. So a lot of people, the reason why when they eat certain things is because they develop some sort of allergy or reaction to food, because that molecule has gotten out and the immune system sees that. And so now they react when they have foods, or they can't eat this food because they have this reaction. So the second step is, in order to really fully heal the gut, we have to figure out what's the main allergies, and we have to eliminate those foods. It's not that your gut won't, the more your gut heals, the more we can try to introduce those foods back in. But if we get some form of reaction, then we know that the gut is not fully healed yet, and then we just keep it out. Sometimes it's best just to keep certain foods out. People don't make enough, they might not make enough enzyme, to fully digest that food. So that's not so much of a immune allergy as it is just like an intolerance. So we are looking at intolerances and we are looking at allergies, and we have to kind of address both of those in order to heal the gut. Because as long as there's any allergy, the gut will not fully heal. There will always be some kind of assault in there, because when they do eat the food that they're reacted to, the gap junctions will open, because it causes a lot of damage internally, to have that going on. So that's one of the reasons why it's just like a lot of people don't like to give up their foods, and they like, I don't have a problem with that. But what happens is when people are allergic to something, they will get the warning signal on the first couple of tries, and then they just blow past that, like the leaky nose, the headache, the belly ache, whatever. And then they just keep eating. And then the body's like, oh, we got to dampen this reaction down. So then it does. The reaction dampens down, and then you start craving that food more. So you're just eating the food that's damaging you more. So when we remove that food, it allows the body to reset its alarm phase, right? So that the next time you have that food, there will be a reaction. So if we wait 3 weeks, a month without doing that food, like let's say olive oil, everybody loves olive oil, but some people can't tolerate olive oil. All right. It's because there's a fruit component to the olive oil, and that's what they're intolerant to. So whenever we do that, I've had people that have gotten off the olive oil, literally ate a little bit of olive oil and vomited. So that's a reaction.
Right.
That's a form of the body rejecting that, saying, this is not good for me. This is poisonous for me. Do not put this in my body anymore. So those are the signals that we have to listen, because our body speaks to us, and the gut is speaking to us through different areas, right? Headache, leaky nose, congestion, mucus buildup, cough,
And
belly ache.
isn't it, what I found really interesting, because Jeannie Peters, who's been on the show many times, she's a nutritionist, talked about sort of using the idea of our intestinal wall like a screen. And over time, with wear and tear, the holes in the screen get wider. And but what people don't realize, because a lot of people say, oh, well, I'm not sensitive to that food, or I'm not sensitive to any foods, because they are ignoring the symptoms. And what they don't realize is that this is preventative, because it's cumulative about the damage that gets done. And all of a sudden now you're so far down the path of having gaps and digestion just being completely off that you become sensitive to everything. I've seen people who eat like crap for a really long time and ignore the small symptoms, and then have a big symptom happen, something that takes them down. And then all of a sudden now they're, sensitive to gluten, or they think that, and they have to be off of it. But it didn't happen overnight. It happened in time. It happened, the wear and tear happened over time. So this is where, if we get ahead of things, you won't have the bad things that happen if you can avoid it. So
exactly. Yeah.
So to go back in the like the scope of, here's how we're handling this. The first thing is to test, right? And test and assess and figure out what the problems are, right? And then the next thing would be to pull the foods out. And
so then we're addressing at that point. We're starting to pull the foods out. I mean, we're pulling the foods out. We're balancing the microbes. That's usually we have to kind of clear that out. So you got to kind of make some space, for health in the gut. So we clearing the microbes that are damaging. We're pulling out the offensive foods. And then because at that point, we're starting to work with more of the humus, right? More of the soil, because we're trying to better the soil, and so things like, pulling out I said that already, pulling out all those, offensive foods, eating
corn, wheat, grains, and then whatever else we find.
We find, some people like the tapioca, especially all our keto friends, right, who love the tapioca, that's in the chips. There's a lot of chips that are supposed to be keto friendly, right?
Well, they're not really low carb though. Like tapioca is not low carb.
They're not. That's it's so funny. I did a little research in preparation for, I'd like to teach a class on nutrition in the next year, in 2022. And it will be a little bit on keto, but it's going to be just on a basic diet platform. And one of the things that I went to Costco. We get some of our vegetables at Costco, because here at the one, we get these nice local, or sometimes the local farms will just bring some of their organic vegetables there. But I kind of went around the store and I was taking pictures of a lot of these foods that are advertising as keto, right? Literally these chocolate squares that says keto, on the basically on the front package. Then I flipped the package around and I took a picture of what's in it. It's like cane sugar is like the second or third ingredient. So I'm like, there's nothing keto about cane sugar,
right?
And you have to and that's one thing I want to help people, is you got to kind of get past like that whole advertisement, because everything, keto is a fad right now. But the keto that I like to work with is not a fad. It's more of a therapy. And so, just kind of got off on a tangent with,
well, that, like when you were coming here for a VIP day, right? And I was like looking up keto recipes for things, and there were stuff that was keto, and then there was stuff that I thought, well, it was not low carb, but it was grain free, like tapioca. That's when I asked you, like, are you okay with this flour or that flour? Because I wasn't sure how keto or what, where the line was, because tapioca flour isn't keto. I don't know why anybody would think it is.
Yeah.
It's not low carb. But again, it's advertised as, or let's say a recipe on Pinterest will say it's keto. Yeah, there's tapioca flour. And I'm like, no, it's not. So anyway, so that's a great idea to put into your class. And again, food as therapy, food as healing, food as nutrition, in order to, make the body go. It really, like 70%, right, of our gut, it makes up our immunity. So it's really the central place, and it's the most overlooked place, because as you said, we're so attached to our foods. And I think there's nothing wrong with that in moderation, as long as we're in check with our reactions, we're in check with getting tested regularly, or understanding where our food is coming from, asking questions. I think there has to be a balance. Otherwise, people don't do this because they don't want to feel restricted.
Yeah.
And
Exactly.
until they're so fighting restriction that they're ill and dying, then they're willing to give everything up. And we don't want you to get there. So if you have a snapshot of where you are right now, you can make better decisions about how to rebalance some of the fun foods or change them up. And I don't feel restricted at all, because whatever I want, I just make it in a more low carb, organic way with low grains in it. You don't have to feel restricted. You just have to get creative and learn how to do that. So, all right. So we have the tests, we pull out the foods. And then is there any period of time, like I know Dr. Mindy talks about, I don't think Dr. Mindy Pels, but she talks about fasting and fasting healing the gut. Is there any point in this process where we're adding fasting?
Yeah. Especially in the beginning, when we're trying to kind of change the microbial picture in the body, because sometimes they're very sensitive to fasting, right? And so you can, within a 3-day fast will totally reach, almost, it'll change your flora, So if you're fasting for 3 days, and then when you start to reintroduce, you're doing things like maybe sauerkraut juice, bone broth, bone broth, it has qualities, and sauerkraut juice, it has qualities that actually heal the gut lining, right? So again, we're changing the humus, we're affecting the humus. So that's the first thing you want to do after any kind of extended fast, right? A day, 2 days, 3 days, 7 days. You want to really start to introduce things that, will change, because the gut's kind of, it's a fertile ground at that point. The thing about the sauerkraut juice, it will kind of draw out glyphosate. It's one of just a natural way to draw it out without having to take a pill, without having to take, some supplement, some homeopathic preparation. You can just, they have these little sauerkraut juice things that, some of these sauerkraut companies make. They just sell their juice.
Wild Brine.
Yeah,
they've sponsored every event that I've had. They have shots. The Wild Brine shots, and they're delicious and they're great. And I definitely recommend that. Plus all of Wild Brine's products. Once you're done eating the sauerkraut, you can drink what's left. But you also, before you get off this topic of pulling out glyphosate with juice, with the sauerkraut juice, you also, another way to pull it out would be infrared sauna, right?
Yeah.
Infrared. Yeah. Okay. Yeah. Just so that people, and sweating. So we have the three ways: sauerkraut juice, infrared saunas, and sweating are the only ways really to pull out glyphosate out of your tissue to help heal your gut. But going back to, 3-day fast, we're adding in sauerkraut juice and bone broth to help heal the humus and the tissue. And then at what point after, so we've done the fast, we've done adding these foods, we've eliminated these foods. What's the time frame, do you think, from start to finish before we retest and see where we are?
6 months, you can retest at 6 months to see, like when people have H. pylori, usually I like to retest around 6 months to see, like, has my treatment been effective? I don't like to use antibiotics to do that kind of work. Well, I was taught by Dr. Rao that he was really anti-antibiotic, right? Unless they actually, you're dying and you need them. But a lot of people have been just over given like I have a patient that, every time she has a slight inkling of a UTI, she gets an antibiotic prescription, right? Her doctor has done that for years for her. Now she's trying to manage it a little differently, but doing that has set her up for so much issues, in her gut, that it's going to take more than a year just to really kind of restore some of that. She's looking at 2 or 3 years of work to just try to restore some of that. And then maybe she will never get it back to what it originally was. That's the other thing. When people get overdosed with antibiotics, or they're taking antibiotics for like a viral infection, for things that they don't need that for, then, that it doesn't, it's not without consequence. It's just not. So it does set people back. Literally, when we have to do antibiotics, it'll set you back like 6 months. That just one dose antibiotic, right? Back in September, I had some dental stuff that I had to address. And, the guy he wanted to give antibiotics. Now I was like, I'm not taking an antibiotic pill, but I'll let him do an IV antibiotic. But still, even with the IV, there was a little bit of casualty. Now I haven't had antibiotics in over 20 years. When I've done, like gut tests, I had a huge, my gut diversity was like in over the 95th percentile, because I had allowed so much time to go that it was able to restore itself. Now I wasn't one of the kids that had, ear infections that were given, antibiotic after antibiotic. I could count on, maybe one hand, two hands, the times as a kid that I was given that type of medication. So it wasn't that often, not as often as some of the other, individuals that I kind of run into in practice. They're actually overdose. So back to Dr. Rao. Dr. Rao was very anti-antibiotic. And I learned a lot from him, because that's where I learned how to really work with the gut. Because usually when people will come, we'll start with, the allergy testing. We'll start with the gut testing. We'll kind of remove the allergies. We'll kind of start to, try to eliminate some of the microbes that are there. We'll retest. But then eventually what I do is I will have them get some of those remedies that Paracelsus gets, so that we can start doing that. Because if we do that 1 to 2 times a year, it's a whole protocol that they do there. And that really, literally, I've seen people, it's like, I seen tests change, from doing things like that. I've seen people, physically, like cancer patients, really physically make shifts after that. So it's something that I like to use. I don't pull it out right away. We try to do a lot of groundwork, but then when I know the groundwork is going well, then I want to kind of give the humus, the soil of the gut, a boost to do more. And I know those remedies they do exactly that.
Okay. So again, jjflizanes.com/leaky gut to get all the tests, all the recommendations, to get Dr. Chris's information, although we're going to talk about that in a second, and to have him help you and to make some of these recommendations, and just all resources in case you're not ready, or work to do before you get there. So let's talk a little bit about how you work and your website, and where can people go to find you. Sure. After they're going to get the list.
Okay, so the primary way to find me is my website. So it's clearmindintegrativehealth.com. So that is, if you just Google that or put that into your web browser, clearmindintegrativehealth.com, it'll pull up the website. You can learn about what I do. You can read my bio on there. There's also a space where you can make contact. My admin assistant, Sonia, she's really, really good about responding to emails, because we'll get dozens of inquiries about people who want to become a patient, or people they want questions answered. And so she'll answer a few questions. She might spend up to 15 minutes, just maybe answering a few questions. When patients come to schedule, onboarding them is a longer process. She'll spend up to 30 minutes with them, just trying to let them know what to expect. So that's pretty much the main way to kind of reach out and get in touch with me.
When you download the resource guide, the Leaky Gut resource guide at jjflizanes.com/leaky gut, you will be added. Chris will get your name as well, and then they'll reach out, especially if you want to be a part of the class, the upcoming class he's going to do, or just to find out more information. But you will be added to his list of people that are interested in possibly either working with him or learning from him or being part of a class or learning about some of the supplements and tests that he uses. So know that going in, even though you're coming to my site to get the resource guide, we will be sharing that you have an interest in this in case Dr. Chris is someone you'd like to work with, which of course, this is one of the reasons why I'm bringing him to you, because of course, most of the doctors that I have on this show don't take patients. So that's not very helpful. And now that I have all the metabolic approach to cancer doctors, and I know you the best besides Naisha, and this is an issue I see rampant, and I want to take all these tests. So sign me up. I want to do all this because even though I'm better than the average, doesn't mean I know I still don't have stuff, because I got some stuff, because I got a leaky nose, and I get congestion when I have dairy, and we know that. So, and I try not to have it, but there are times where I'm like, oh, right. So, and I'd like to heal whatever still needs to be healed and work that out. So, thank you, Dr. Chris.
You're welcome.
And any last information for people?
Just visit my website, clearmindintegrativehealth.com. We will be kind of, there will be a class coming soon in 2022. So just be on the lookout for that. And it'll probably give you more information about what we talked about today, maybe fleshing out a little bit more on some of the foundational stuff. jjflazanes.com/leaky gut. You get your resource guide and get started, because we want 2022 to be your healthiest year yet. Thank you, Chris, for coming on the show. Okay, thank you.